Hey everybody, Dr. Alex Tam here, and today's webinar I am so excited to share with you on the aging population that we have and how neuropathy affects you. With mature adults, older adults, neuropathy can be a problem. It is an epidemic because we have more patients with neuropathy than ever before coming into our office. The rates of neuropathy from other chronic conditions are continuously rising. And the reason why I'm so passionate about this, let me share with you why, is not just because I like to talk about neuropathy, it's because it has hit our family firsthand. To give you some back information, my own grandmother, when I was 18 years old, was diagnosed with neuropathy. She was probably diagnosed with neuropathy way before that. But we started seeing symptoms and signs, and what ended up happening is she spent the last 5 years of her life in a wheelchair, the last 2 years of her life with one of her feet amputated. She spent the last 5 years of her life in a wheelchair and the last 2 years of her life with a foot being amputated. She lived with my aunt and haven't left the third floor because there's no elevators ever since she was in a wheelchair. My grandmother had diabetes, but there was no one around us that would be able to share with us what diabetes and how it affected neuropathy. Even though we had nurses and doctors in the office, even though we had nurses and doctors in the family, no one really knew what it was about, and that was ultimately the problem. So today I'm going to share with you, we've been working with people with neuropathy and reversing neuropathy for almost a decade now, to think back at it. And you have to know these certain things in order to tackle neuropathy. There's no doubt people with diabetes have the highest chance of neuropathy. 80% chance of neuropathy is something that you will experience. There's an 80% chance if you have diabetes. There's other causes of it that I'm going to show you and share with you on this webinar. So listen up. Pay close attention. I hope you learned something, whether it's for you, your family, or your loved ones. So who am I? Number one, let's dive that in, okay? Dive into that. Who I am is I am a doctor of chiropractic. I received my Bachelor of Science in Exercise Biology from UC Davis, and I've been a clinical director at Absolute Integrative Physical Medicine since 2009. We've helped and treated over 10,000 cases over the last going on 16 years now. And our mission is to help patients with chronic pain get their life back without harmful drugs and unnecessary surgery. Now, you have to understand what neuropathy is. Most people would tell you neuropathy is a nerve problem. Damaged nerves leading to symptoms like pain, numbness, weakness, burning, tingling. And for a lot of older adults, it's especially concerning is because as we age, neuropathy creeps up even faster. But what a lot of people don't tell you is early detection and intervention in managing neuropathy is key. Now in this webinar, I'm going to go over some critical information on how everyone needs to know what to do, on how to prevent neuropathy from the first place, and look at the latest treatment options and things that you can do on your end naturally. So, triggers of neuropathy. Diabetes, the first one. Number one trigger for neuropathy is diabetes. Like I mentioned before, 80% of people who experience diabetes will have some form of neuropathy in their life. Number two, vitamin deficiencies. B12, the Bs, that's a big one. Injuries, trauma to the spine, trauma to your legs, trauma to your feet, your knees, your ankles, that's another one. Chronic conditions such as arthritis, kidney disease, hypothyroidism, blood pressure problems, breathing, lung problems. Remember, lack of oxygen, that's what can cause neuropathy. Medications, that includes chemotherapy, different drugs, heart medications, antiviral medications, Anything that can kill blood flow into the body, tear down the lining of the blood vessels, and ultimately killing the nerves or deadening the sensation of the nerves. These are all things that can cause neuropathy. So you might ask, okay, what are some of the signs that I need to be watching out for? Tingling sensations, burning sensations, weakness, sharp jabbing, stabbing pain, super sensitivity to touch, and especially a loss of balance. These are the 6 signs that you need to be watching out for with neuropathy. Now, how can neuropathy impact us as we are aging? Well, as we age, our body goes through natural changes that can impact nerve health. Understanding how these aging effects can function and affect us is really a key component in attacking neuropathy. So number 1, slowing nerve regeneration. Okay, slower nerve regeneration. As we get older, our nerves, our body in general, our skin, hair, skin, nails tend to not regenerate as quickly. Other things like reduced blood flow. Our heart might not be as strong, our oxygen exchange between the lungs are not as strong, so reduced blood flow, reduced oxygen is a concern for neuropathy as well. Increased susceptibility to chronic conditions like diabetes, right? We're losing muscle mass, we're gaining fat, and that's in general what happens as we age. This increases your chance of neuropathy, 100%. Cardiovascular diseases all can cause nerve problems to blood flow problems as well. Well, how do we prevent it? What are some key strategies that I want to show you that you can do today to take over your health again so that either you can reduce neuropathy symptoms if you already have it or prevent it altogether? Now, before diving in further into this, if you already have neuropathy or have one of those 6 symptoms, you ought to get a neuropathy exam. Get checked to find out, okay, what's the level of neuropathy you're at? Is it too far gone or is it not too far gone yet? I'll dive into that a little bit later. I want to talk about nutrition. Having very well balanced nutrients in your body is one of the key things that you have to do. Well, think about diabetes. Most people who have type 2 diabetes, you acquired it. Type 2 is acquired. Type 1 is something that you were born with, okay? You acquired it through eating habits and lack of movement. So let's dive in. Some of the best foods that have great B vitamins is in your eggs, your fruits, your fish. These are essential for nerve repair and nerve regeneration. Omega-3 fatty acids, taking fish oil, eating the right amount of fish, eating the legumes and proteins and everything that you have. These are called essential amino acids, right? Part of it is omega fatty acids. You have antioxidants. A lot of antioxidants in nuts, healthy fats as well. In vegetables, you need all 3 in order for your body to start regenerating nerves and slowing down the problems coming from neuropathy. Now, keeping your nerves active and with more physical movement is one of the big key things. Nerve flow is so huge. See, how neuropathy starts is, you imagine, neuropathy is a nerve problem. That's how it's diagnosed, but it's actually a blood flow problem. The lack of blood flow to your nerves is what causes the nerves to light up and cause problems to your nerves, and your brain sense, well, the nerve is damaged. It's going to light it up by giving you sensations of stabbing pain, burning, tingling, pricking, or eventually leading to weakness and loss of balance. Well, you might ask, well, how do I lose balance? Well, that's because your brain can no longer see where your feet is. So the moment you close your eyes, you start swaying back and forth. We do our neuropathy exam in the office, and you should be able to last 30 seconds with your feet touching together with your eyes closed, standing up, right? Be careful and have a professional when you do this test. Don't try to do it at home if you know you could have neuropathy. So improving circulation is key. Strengthening muscles and nerves is another key. Well, why is it that people with diabetes need to build more muscle? That's because as we age, we lose muscle, and a lot of your glycogen and glucose storage is in the muscle. So if you're eating a meal, someone with muscle versus no muscle, if you don't have enough muscles, where does that glucose and the sugars go? It goes directly into your bloodstream, having your liver, kidneys, and all the other organs to process it instead of being stored in the muscles. So strengthening muscle exercises helps your nerves 100%. Promoting weight management. You have to maintain healthy weight. Look at your BMI, right? A lot of people say, oh, BMI is inaccurate. Yes, if you have a good amount of muscle mass, BMI could be inaccurate. But you have to make sure you maintain good weight, right? Watch what you're eating, maintain good weight, do your exercises, because studies show people who are overweight, morbidly obese, are going to have a higher chance of neuropathy based on the fact that there's a higher chance of diabetes, heart problems, and other obvious issues that you already thought of. Another problem with neuropathy is not only in your feet, is something called autonomic neuropathy. Autonomic neuropathy is something that causes your kidneys, your organs, your liver, your stomach, your digestive system to break down. One of the early signs of neuropathy, on top of tingling, burning sensations in your lower limbs, is actually lack of motility or too much motility in your gut, causing all kinds of other problems, digestive issues. So how do you protect your nerves and really manage your sugar levels? First, you have to know where your sugar levels are, right? If you have consistently high sugar levels and you have diabetes, the first thing you need to do is you need to monitor it. You need to monitor it with a monitor every morning, throughout the day, after a meal, to see where you're at. You have to hydrate, because hydration helps dilute the sugar in your bloodstream and helps your kidneys take out a lot of the toxins. You gotta manage your stress. Here's what I mean. Your body runs off of hormones. One of the biggest hormones is cortisol. And with cortisol increasing in your body, you increase insulin resistance, leading to further diabetes as well. So you gotta work on these three things, all right? So how do you prevent injuries? Well, number one, you have to take care of your feet. Check your feet. If you cannot feel your feet, you have to check it regularly, multiple times a day, to see if you had a cut. How did my grandmother lose her feet? Well, she had a cut, right? She had neuropathy. We didn't know what it was. She lost circulation. She had a cut on her foot. Her foot got infected. And when the infection leads to the bone, well, that's when they have to say, well, you either lose your foot or the infection continues to go up your leg, and now we have to take out the whole leg. So our family, my aunts, my father at the time, decided to, well, let's amputate. My grandmother agreed, and she didn't want to lose her whole leg. 2 years after that, she lost her life. Home safety. Well, how do you prevent injuries to begin with? You have to watch where you're going, right? Making sure that you're taking away, if you got grandkids, taking away those Legos that can cause foot problems, right? Can cause you to have missteps. Install rails in showers and bathrooms to prevent falls because you're losing your balance. Number 3, proper posture. You have to maintain great posture throughout the day, every day. Prevent looking at your phone. I know it's tempting. Maybe you're even watching this on your phone, but prevention is key. Get better posture, guys. Sleep with better posture, sit with better posture, drive with better posture, and walk and stand with better posture. So knowing what to avoid and protecting your nerves by avoiding common triggers can really help you with neuropathy in the long run. So what do you have to avoid? Well, what else are things that can take away oxygen? Smoking, right, removes oxygen because it blocks the oxygen absorption in your lungs. Excessive alcohol consumption, toxins in the body, that adds more toxins in your blood. Well, if you have more stuff in your blood that's non-oxygenated, that means you have less oxygen. Exposure to toxins. Make sure the lotions, the shampoos, the detergents, the soaps that you're using is not going to kill nerve fibers. There was a study done where antimicrobacterial soap causes tingling in a lot of healthcare providers' hands, and that was causing nerve damage. Do your studies, look at some of these things, all right? And finally, well, what can be done to reverse these problems? We've helped a lot of patients through cold laser therapy, shock laser therapy, shockwave therapy, home exercises, vibration therapy, and special lights to reverse neuropathy on top of the nutrition supplements. There is hope. When someone tells you, once you have neuropathy, you have it for life, it's not true. It's not 100% true because we're able to reverse it. But science is science. This number, this magical number, all right, has been proven, even proven in our office. I want you to remember this. It's 85. What does that mean? That means if you have more than 85% nerve loss, it's very, very difficult, nearly impossible to reverse nerve damage. Is it possible? Yes, but is it probable? Not as much as if you had less than 85% nerve damage. We have 97% success rate in all of our patients across the board in helping them reversing these problems and improving these problems. So if you or someone you know may have problems with neuropathy or could be experiencing it, you got to give us a call. Give someone a call. Find out from your doctor. Give us a call and let us find out for you who's in your local area. Maybe you're watching this video in New York. We're on the West Coast. Maybe you're watching this video in the UK, right? Maybe you're watching this in Asia. Contact us. Give us a comment, a message, depending on where you're seeing this, and let's get you the help that you need. All right? Thank you for joining us today. Okay? I just really wish a lot of people would reach up and get help, right? That's what we're here to do as doctors. We're here to help you. And this is not to replace anything that your doctors say. Make sure that you take this information, ask your doctors about it. Talk to your doctor. We work hand in hand with a lot of neurologists, doctors in our area to make sure that our patients are getting the best care. And I hope that you're getting the best care from it as well, because no one should need to suffer like our family did, not knowing what neuropathy is. When I found out what it was and that it's possibly reversible, I went to seminar after seminar for over a year just to bring the information, the knowledge, and the technology back into our office. Hope you learned something today. Have a great day. Share this video, please. Take care.